Hey everybody, Dr. Dane with your wellness practice tip of the day, and I want to review a poster that we use with our patients prior to their exam and after their consult. And we call this the 3 core essentials. This was developed by Dr. Blake Derrick, and I absolutely love it. I think it really explains what we do, why we do it, and what we're looking for in their exam. Had an exam this morning, and I did exactly what I'm about to do with you. So I'll bring a patient over here. I'll say, her name was Bridget. I said, Bridget, step over here. I'm going to go over what it is that I'm looking for in your exam to see if I can help you. There's 3 core essentials that you need for good spinal health and to feel good. Number 1 is alignment. Okay, anything that's out of its normal alignment creates distortion, and distortion creates strain, and when you have strain, you have improper movement. But also in the spine, you have these individual nerves, and I'll usually go over here and I will poke on some of these nerves. I'll see that where they're having a problem. Let's say she was having a problem in her lower back, so I'll push on L5. You'll see that those nerves that come out through the spine go out through the lower back. So we want to take a look at the alignment of all those vertebrae. A vertebra that's out of its normal alignment, we call that a subluxation. Just like the word dislocation means a bone pops out of joint, sub means less than. So a subluxation is a misalignment, but in the spine that's particularly devastating because it can have impacts on the nerves and the discs. The second thing that we're looking for is good core stability. And good core stability is 2 things. It's having good core flexibility, good movement in the spine. There's 53 joints in the spine. It's very dynamic. It's designed to move. The second thing is we want good core strength. When you have good core strength, your spine is more apt to have good alignment once we fix it. So if you have poor core strength, I can adjust you till the cows come home, but you won't hold your adjustments. And then the last thing we look for is spinal compression. And we see a lot of damage in people's spines, particularly in the cervical and thoracic, lumbar spine, because of spinal compression. There's 4 things that compress your spine: your head weight, your breast weight, your belly weight, and your hip weight. So any excessive compression to the spine or the weight-bearing joints, the hips, knees, ankles, are going to create damage to the spine. One in particular that we'll look for today is head weight. As your head moves forward, for every inch it moves forward out in front of the spine, it causes 10 more pounds of strain on the spine. And the human head weighs approximately about 12 pounds. So 1 inch of forward head tilt makes the head seem more like 22 pounds to the body because it's adding 10 pounds of compression. If you have any or all of these, you're a good candidate for what we do in the office. And with your exam today, we'll be doing a functional movement screen. We'll be taking digital pictures of your posture. I'll be palpating or feeling a spine for subluxations, and then we'll be taking x-rays. And if you have any of these issues or all of these issues, you're in the right place, and we'll go over that with you. So then I start the exam. I start with the bilateral weight scales. I move into the functional movement screen. I do my palpation, and then from there I do my x-rays, and the staff comes in and they do everything else. So this is Dr. Dane. Make sure that you're explaining what you do and why you do it to patients so they can have an aha moment that you're not like every other chiropractor. You're not treating pain. You're actually treating the dysfunction that's causing the pain. Law of cause and effect. So this is Dr. Dane with your wellness practice tip of the day, and always remember that wellness is an inside job.